Go ahead, ma'am.
Hello, good evening. I am Dr. Pallavi Tapala, Fertility Specialist at Oasis Fertility Center, Pune. Today I am here on behalf of Nilesh sir to discuss with you on the topic of obesity and infertility. So, what is obesity? Obesity is the accumulation of fat cells in the body in excess. So, usually we calculate obesity depending upon individual's height and their weight. So as the individual height varies and the weight varies, the obesity, the BMI varies. So the BMI is calculated by weight by height square. Normally, the BMI should be between 18.5 to 25. Above 25, it is called as obese. Above 25 of BMI, it is called as overweight, and above 30, it is called as obese. I would say it as a new worldwide pandemic nowadays. Even in India, the incidence of obesity has increased drastically nowadays. So the urban population now is suffering from obesity in almost 50% of the population. And the children, almost 30% of the school-going children are obese now. So what this obesity causes? So regarding the infertility aspect, the obese women or men are 3 to 5 times less likely to conceive than the normal women with a normal BMI. So as the BMI increases by 1%, there is a chance of decrease in the fertility by 5 to 10%. So either a male or the female, if they are obese, then the fertility part is affected. So it takes longer time than the natural, than the time that is taken by the couple who are trying naturally with a normal BMI. So how this obesity actually impacts? So the fat cells which are accumulated in the body are hormonally active, and they produce certain inflammatory mediators and they produce certain hormones as well. So these hormones impact the central activity of what are the hormones that are produced by the hypothalamus in the brain to the pituitary to the ovaries. So this central pathway is affected by these fat cells, the hormones that are produced by the fat cells. So especially in females, this obesity causes anovulation, which is a failure to ovulate. That is, a female cannot release egg. In every month, female usually releases 1 egg per month. But in obese people, the fertility is affected by anovulation. So these women can ovulate only in 2 to 3 months once. So by this, the fertility is decreased to certain extent. Even if the woman ovulates, the quality of the egg is affected because the fluid which was surrounding the egg contains high toxic materials which are released from the adipose tissue, that is fat tissue. So this impacts the quality of the egg. The obesity also impacts the uterine lining. So the uterine lining, it becomes not feasible for the embryo to attach in that inappropriate lining. So obesity affects the egg quality, obesity affects the uterine lining as well. Apart from this fertility aspect, obesity has long-term effects on the body of an individual. Whenever there is obesity and increased production of estrogen in the body, the females are more prone for PCOS. You might have heard this condition called polycystic ovarian syndrome, wherein the females fail to ovulate and all the ovaries accumulated by lots of follicles with lots of water. So apart from the PCOS, there is more chance of conditions like fibroids, adenomyosis, endometriomas in the females, which impair the fertility along with this anovulation. Apart from this, once we start the stimulation cycle, when a patient comes to the fertility center, obese patient, when we start her with stimulation, whatever the cycle it could be a natural cycle or IUI cycle or IVF cycle, the dose of injections that are required to stimulate that particular person is high in case of obese people. So the injections are given in high doses and the duration for which the injections are to be given are also longer in the obese people. And in fact, the quality is almost compromised in these people, either the ovum or the embryo. Both of them are compromised in the obese woman. So even after crossing all these limits, if the woman conceives, in obesity, there are pregnancy-related complications as well, particularly if the BMI is more than 30, when the woman is obese, or more than 35, when we call it as severe obese. In these conditions, there is more chances of miscarriages, that is abortions. Why do this happen? This happen because of first thing is the quality of the embryo is already compromised in the obese individuals, and the second thing is the endometrial lining is also not properly formed in these individuals. The endometrial lining and the embryo will not come in synchrony, so there is more chances of miscarriages. And in a second trimester, once these first 3 months are done, in the second, like in 4 to 6 months, which we call it as second trimester, there are more chances of the woman getting diabetes and pregnancy induced hypertension. There are more chances of hypertension and diabetes in the antenatal time, that is during the pregnancy time. And during the time of delivery, there are more chances that the baby, because of this obesity and insulin resistance, the baby will grow more in size. So there is incidence of large for gestational age, what we call it as the baby will have more weight. So what this more weight baby causes is there is more incidence of cesarean section or operative deliveries and more chances of long-term stay in the hospital and long-term morbidity because of the cesarean or any surgery that is going on. So obesity not only impacts the fertility aspect, it has long-term effects till the delivery. And even if the women or men are obese, in long-term life, they are more prone for the cardiovascular problems and they might get a permanent diabetes mellitus and hypertension in long term, along with the cardiovascular disorders like cerebrovascular disorders or cardiovascular disorders. So these are the impacts of obesity. When male, people are of opinion that obesity impacts only the female fertility, not related to male fertility. But this is wrong. Obesity also impacts the male fertility. In males, usually the testes are outside the body of the individual. This is because the testes are supposed to be in a lower temperature compared to all the body parts. So they have been kept outside the body in order to maintain lower temperatures. In obese individuals, because of the accumulation of fat cells surrounding the testes in the scrotal sacs, the heat that is produced by these fat cells impacts the spermatogenesis, which is the production of male gametes. So the production of male gametes is impaired, that is the decrease in the count of the male gametes as well as decrease in the hormones of male, that is the testosterone hormone. In males, because of the obesity, this male hormone get converted into female hormone and the increased levels of estrogen is seen in the males. So this eventually leads to decrease in the sexual desire, which is called as decreased libido, and this causes erectile dysfunction. So these patients also, these males are also have this effects of obesity on fertility. So obesity in turn decreases the sperm count, decreases the sperm quality, decreases the motility of the sperms, as well as it decreases the sexual drive as well as erectile dysfunction. And the long-term side effects are same even in the males, like the diabetes, hypertension, cardiovascular disorders, all are same if the patient is having long-term obesity, like obesity more than 30 or 35 of BMI. So how do we get over this obesity? Obesity is usually generally easily corrected. What I would say is a better proper counseling for them, better guidance could easily rectify this problem and they make them conceive easily. So what are the things that need to be changed in a obese couple is, the first thing is lifestyle changes like a diet. So dietary modifications which contains low fat diet or low calorie diet with high amount of nutrition has to be taken. So what are these kinds of food? Or like fruits, vegetables, nuts, all green type of vegetables, green leafy vegetables, sprouts. These are the things which can be taken in good amounts, and we should cut down the high calorie foods which has high glycemic index, just like maida, corn flour, sweets, oil, ghee, butter, cheese. So all these kind of things, refined sugars, ought to be decreased in amount. And the amount of food that is consumed has to be broken down into small parts. And along with the dietary modification, a physical exercise which is mandatory to reduce or to maintain the body weight. Usually physical exercise of almost 30 minutes to 45 minutes per day can be done 5 times in a week usually. It depends upon the degree of the obesity. We do advise the couple how long they have to do the exercises and what kind of exercises they need to undergo. So generally exercises like jogging, skipping, running, swimming, either dancing or Zumba can be done. Whichever the exercise that releases sweat from the body or more helpful to decrease the body weight in turn. Apart from these two, you can have antioxidant capsules which contain vitamin A, vitamin E, vitamin C. And if with all these measures, if the couple are not reducing, if either of the couple are not reducing the weight, then the end thing what we suggest them is the bariatric surgery, which is the last option, which usually is not required in most of the couples. So maintain good healthy diet, maintain good exercise, eat healthy and stay healthy so that your fertility is not impaired. So this is a brief on the fertility and the obesity and its impact on the fertility. So if you have any doubts, you can ask me the questions. So the question is, can belly fat cause infertility? It is not exactly the belly part which causes infertility. It is the overall body mass index that is calculated by weight according to the height of the individual. If the BMI of individual is between 18.5 to 25, then it is called as a normal BMI, and we cannot consider this belly fat alone as a obese thing. So if the BMI crosses 25, yes, it definitely impairs the fertility. We need to take the measures what I have already discussed. Does obesity cause PCOS? Yes, obesity and PCOS are two closely related things wherein it is like a circuit. Obesity causes PCOS, that is what we have discussed, that it causes an ovulation. The egg is not released from the follicle. And in turn, the PCOS itself causes again obesity. So this is like a circular thing. PCOS has insulin resistance, and the women who are PCO generally tend to gain more weight. And more weight in turn causes more severity of PCO. So yes, obesity and PCO are closely interrelated to each other. Does obesity affect sperm quality? Yes, obesity does affect sperm quality. It affects the sperm quality, oocyte quality as well. And it decreases the parameters of sperm like the motility of the sperm, the morphology of the sperm. So all the sperm parameters are affected by the obesity because of the toxic substances that are released by the adipose cells, that is fat cells. Can I get IVF if obese? Definitely. IVF can be advised for obese people, but first 1 to 2 months of session where we advise them to lose the weight so that we can get more good quality of the eggs or sperms. So IVF is definitely advised in IVF people. There is no contraindication like like the body mass index and the IVF. So we can do IVF in the obese people once they lose a particular amount of weight loss, which we advise them before we start an IVF session. So thank you. I hope this session is useful for all of you. If you have any queries, you can call this on the helpline number which is scrolled down. And thank you.